Okay, so this morning we're talking to our patients, and we heard some stories which I think are interesting. We heard you have a friend with a Roux-en-Y that didn't do very well.
Yes.
Lost only
50 pounds.
50 pounds.
Right.
And gaining some back, did you say?
Gained it all back.
And gained it all back. Then we talked to Lil's niece, and Lil's niece's dad had a lap band for diabetes and hasn't lost much weight at all. So we have a story of a family member who had the lap band that failed. Okay? And did you say you had a friend who had the Roux-en-Y, who's gained most of her weight back?
Yeah, all of
Okay.
plus.
Now what we wondered, doesn't that sound like interesting and probably, I mean, you're not making that up to make me feel better, right? You're not saying, I think I'll make Dr. Rutledge feel better by making up some stories about your father.
Her brother.
Yeah. You wouldn't do that, right? You're telling me what we thought. Isn't that truthful information? Could we ask all of our patients that question? In other words, we hope and pray that our patients are honest, and we said to ourselves, as part of our follow-up, why don't we ask our patients this question? Do you know anybody? Do you have a family member, an acquaintance, who's had a lap band, a Roux-en-Y, or an MGB? Okay? And here's the results. About 50% of our patients knew somebody who had one of those. About 50% lap band, 50%, 50%. Almost half of our patients know somebody. So that just shows you that in the United States, weight loss surgery is pretty darn common because everybody knows somebody, or at least half of us know somebody who's had the surgery. Now, when we ask about the Roux-en-Y, we said, do you know somebody? 50% said yes, family member, friend. We then ask them a really simple question. How did they do? We didn't go into a lot of detail. We just asked them, are they doing great? Have they gained their weight back, or did they have a complication? Which one of those is the best answer to describe your friend or family member who had a Roux-en-Y? Of that group, it broke down as 30%, 30%, 30%. 30% knew a Roux-en-Y patient who's doing well. 30% of their friends or family answered that they had a friend or family member who gained their weight back, and 30% had a complication. 60% bad, 30% good results in friends and family who had a Roux-en-Y. I would say terrible results. We asked about the lap band, it was even worse. Only 20% did well. And the data on the lap band is the longer you wait, the worse it gets. But then we ask about the MGB. 95% of those people who knew somebody had an MGB had done well. And the other 5% broke down about 2.5% for weight regain or complication. And that's kind of what we heard here again this morning. So our research suggests if you just ask people, on average, they're going to tell you that Roux-en-Ys and bands, in their experience, don't do very well. But if you ask them their experience with the MGB, pretty good.